Hi, I'm Lizzie from the Health Recovery Centre. Thanks for joining me today. Today we are going to be discussing how our mental and physical health how they all connect and how we end up with these mental health conditions, but they always come with these parallel physical issues. So all too often I get clients coming in for treatment for digestive issues and they've gone through every test. They've had colonoscopies, endoscopies, the lot, and they're all told it's all normal. At the same time, they're suffering with depression, anxiety, and other mental health conditions as well. So I just want to talk about how all of these link together with chronic pain, with chronic fatigue, with even immune issues, so regular colds and flus, or autoimmunity, or hay fever and those types of things. So today I just want to explain all of that. I'm going to draw you a picture, which is riveting. I'm not an artist, so you'll have to be very patient with me. So we have a few points to this, okay? So the first issue is stress hormones. Then we have digestive bacteria. And then down here, we have our neurochemistry, which are the brain chemicals that determine our behavioral characteristics. So they do our sleeping, eating, drinking behaviors, our interactivity with other people, our self-esteem, the way that we feel about our environment. So our neurochemistry does a whole lot of stuff. It also then regulates our digestive system as well. So it all ends up getting tied together. Get that out of the way. So what happens is we get a period of stress and our stress hormones elevate, which shuts off our digestive system. So basically it stops us producing the same level of gastric acid. And when that gastric acid starts to get lower, it means that more pathogenic bacteria actually survive the transit through the stomach. We also then get a shift in our pH further down in the digestive system, which makes it uncomfortable for digestive bacteria. So we get this shift in our bacteria. Our bacteria actually make a lot of our neurotransmitters. So if we don't have the right bacteria, we don't have the right neurochemistry. So it's really important to make sure that that bacteria is in good quantities, the right types of bacteria. It's no good having, a ton of bacteria if none of it's doing any of the jobs that we need it to do. So our digestive bacteria regulates our neurochemistry. Our neurochemistry being low, so whenever we get a neurochemistry deficit, we end up not being able to process thoughts properly. So we don't actively problem solve in the same way. So it causes an elevation of our stress hormones, which means worse digestive system, worse neurochemistry, worse stress hormones. So by now somebody's experiencing a fair amount of symptoms. They're depressed, they're anxious, they're tired, they can't think, they're foggy, they're feeling overwhelmed, they might be feeling, like their stress, like their environment's very stressful, their relationships will be suffering, their self-esteem will be suffering, they may be putting on tons of weight or losing tons of weight. And they just generally they're not feeling well. They'll definitely be having digestive symptoms by now. So even if they're doing solid poos every day because they're taking a fiber supplement or something like that, they'll still be having some gastric issues where it's not the right color, the right texture, all of those sorts of things. So poos are very important. Just ask any naturopath. So here we have two more very relevant areas. So we have nutrition. So we have exogenous and endogenous nutrition. So it's the nutrition that comes through things that we put in our mouth. That's exogenous nutrition. Then we have endogenous nutrition, which is the nutrition that's actually produced by bacteria. So for example, our B12. So 90% of our B12 is actually produced by bacteria in our gut. We don't even ingest it. So it's made by them. When our bacteria get out of whack, we get low vitamin D, even though it comes from sunshine. We require good digestive bacteria to utilize it. We get low vitamin K, we get low vitamin A. Often we see people with chronic low iron conditions at this point. So our nutrition further impacts digestive bacteria, further impacts neurochemistry because our neurochemistry is made of proteins, and further impacts our stress hormones because our hormones are made of fat. Then we have, of course, our stress hormones further impact our nutrition. Our digestive bacteria further impacts our nutrition, as does our neurochemistry. So they all tie together. Then we have over here our methylation pathways. So methylation is the process that your liver uses to clean things out. It's also directly linked to digestive bacteria, stress hormones, and neurochemistry. So some of our methylation pathway is actually neurochemistry. Others are the nutrients that we're lacking from this nutritional issue. So with methylation, this is things like MTHFR disorders. So a lot of people get the genetic tests done. At Health Recovery Centre, we don't really do that unless you want it. The reason why we don't do it is because it's irrelevant. So you can have a gene turned on or a gene turned off, but all that matters is how's the methylation working. And so methylation is changeable. So even though someone has the same genes now as they did 6 months ago, their methylation profile could be entirely different. So all that matters is that we're testing that methylation and making sure it all works. So to get all these things working again, we have to fix them all at once, because you can see how they all impact each other. You can't just fix digestive bacteria, for example, and expect the rest to go away. We have to make sure all of these parts are working together, because there's no disconnected part of our body. We are one thing. So whether we experience mental health symptoms primarily, or digestive symptoms primarily, or pain primarily, it's all the same problem. So we need to do testing. So it depends on what the person comes back with. We recommend, some testing, sometimes a lot of testing, sometimes a little bit. Pretty much always digestive bacteria. Very commonly, we do a methylation or a stress hormone testing, because we need to know how everything's impacting. Also, something interesting, our stress hormones are actually our primary hormones. So from there, we actually produce our sex hormones. They're in the same pathways, but your sex hormones won't be working functionally if you have changes in your stress hormones. So that's another common thing that we get. We see PCOS. We get, men with prostate issues. We get, or erectile dysfunction. We get females with endometriosis or adenomyosis, or any of our, female hormonal cancers. So all of these things really tie together. And if left unchecked, you actually end up with really significant health problems. Stress hormones also do blood sugar metabolism. So we're talking diabetes, we're talking obesity, we're talking all of those really chronic conditions. Our digestive system does all of our nutrition. So we're talking malnutrition. Like, these are really significant issues. And as we age, they become more problematic, because our body can only keep up. Basically, it's like Lego. We put all the pieces in and our body sticks the bits together that we need. But as we go, we chuck out more and more pieces. And eventually we don't have all of the Lego pieces to make the bits we need. So we need to make sure that we're topping that Lego up all the time. And if you don't have the right bacteria, you won't have the right nutrition. You won't have the right neurochemistry that regulates backwards to the digestive bacteria and backwards to nutrition. So it's really, really important that you're assessing and treating all of these things at the same time. So if you do want to get some more information, you can contact us on our website, which is healthrecoverycentre.com.au. And on there, you can either book in for a free 30-minute consultation. Those consultations, we basically get all of your health data. And from there, we go back and say, okay, based on your information, because obviously no two people are the same, we would do this testing, and this testing, and we would like, we can expect it to take about this long to get, to where you're feeling better. We can expect it to cost about this much. We can expect about this many consults. So we can give you a bit of an idea of what to expect, what you'd actually have to do. So some people, it's really simple, they just have to go on a diet and take a couple of supplements, great. And other people, they might be on 15 supplements and everything's quite complicated. So we just need to make sure that it's, it's all tailored to you, but we can give you a bit of an estimate in that free 30-minute consultation. That way we can make sure you're a good fit for the clinic as well. So because we are a specialised clinic, we need to make sure that we're treating the people that's best for us. If you're not a great fit for the clinic, we'll definitely tell you where to go. So we'll give you some ideas of what you can try next. So to make sure that you have, somewhere to go from there. So some way to progress with your health journey. If you do have any questions, get in touch. As I said, you can find us on the website. All of our phone numbers and things are on there as well. You can book in for one of those, or you can just ask me some questions if you'd like to. So feel free to get in touch and we can go from there. Thanks very much for joining us today. Much appreciated. And we'll talk to you soon. Thanks.